Hi guys, are you able to manage temporomandibular disorder patients? Are you able to do it properly, or are you still with the past theories of neatology and the complexity of a topic that is actually really simple? I guess it's time to attend this new video course recorded with the friends of the osteocom streaming company. For the first time, this is an exceptional event because for the first time we will have both theoretical and practical parts recorded live. The theory will get deeper into different aspects concerning the Bruxism and temporomandibular joint disorder issues. And then in a practical part, you will see my interaction with the patient. You will see interventions of TMJ arthrocentesis live. You will see how to deliver and calibrate an appliance. You will see how to properly diagnose the patient and perform the clinical maneuver. Look forward to your participation. Thanks in advance. I'm enthusiastic of this another adventure. Bye bye.